going to talk about benefits and risks of the epidural. The epidural, like all other interventions during labor, is not good or bad. It is just a tool that can be used to help a woman's labor in some way. So benefits of the epidural: it can help a woman to rest, especially if she's had a really long labor. It can also relax pelvic floor muscles that she may not be able to consciously relax. So, there's only so many muscles that we have control over in our body, and sometimes the ones that make up our pelvic floor are not ones that we can easily relax, especially during labor when there's so much happening down there and things can get kind of tense. Another benefit of the epidural is, of course, pain relief. So, most women are going to have pretty good pain relief from the epidural. For some women, it may not work as well as they hoped, but most women do find that it works pretty well. Another benefit of the epidural is it can actually help a woman to have a vaginal delivery if other options have been exhausted. So, maybe a woman was actually planning an unmedicated birth, but her labor has been very long, progress has been very slow. Getting an epidural can actually give her body some rest and allow her uterus to kind of do some work and hopefully have a vaginal birth if that's what she really wants. The epidural can also provide rest for the support team. So if your partner has been awake for a couple days with you in labor, they can also rest as well while you're resting. And then finally, an epidural can help a woman to just feel emotionally better about her birth. So for some women, just the thought of giving birth vaginally is very intimidating for them, or they're really worried about the pain with the process, or perhaps they've had a traumatic birth in the past, and so having that relief from the epidural can really make them more satisfied with their birth experience and help them to bond better with their baby. Then moving on to the risks of the epidural. So the biggest one is that the epidural can affect the baby's heart rate. And really the reason that the epidural does that is because it's secondary to another risk of the epidural. So what the epidural does is it changes some aspects of the nervous system which influence blood pressure. And so the epidural can lower a woman's blood pressure, which is why that most women, when they're getting an epidural, they'll get a bolus of fluid. So they'll get half a liter or a liter of fluid basically given very quickly before they get the epidural. So getting that extra fluid may help to balance out the shift that may happen with the woman's blood pressure. But basically, if a woman's blood pressure drops, it decreases the amount of blood flow to the baby through the placenta and through the umbilical cord, which then can affect the baby's heart rate. So the baby may experience decelerations or drops in the heart rate, which could cause more interventions. Usually those heart rate changes can be controlled by giving extra IV fluid or changing position, or just giving the woman's body a little bit of time. But on occasion, it could result in a cesarean if measures cannot actually bring the baby's heart rate back up to normal, even during contractions. Another risk of the epidural is that it does come with some other interventions. So like I mentioned, a woman will have to have an IV and IV fluid, and will also usually get a urinary catheter placed. And the urinary catheter may be uncomfortable for some women, other women may not feel it. It does increase the risk of having a urinary tract infection, just because anytime you insert something into your body, there is a risk of infection. Another risk of the epidural is that, of course, it reduces mobility. So even though they have something called a walking epidural, in reality, even if a woman gets that, she's really not going to be getting out of bed. Usually hospital providers don't let women get out of bed once they have an epidural. That being said, they're still going to be able to kind of turn side to side, sit up. Some women, if they have great mobility, may even be able to squat or get on their hands and knees with an epidural. It just kind of depends on what type of epidural it is and basically her individual body and how it's responding to the epidural. Another risk, and it's pretty small, probably only about 1 to 3% of people that get an epidural, is that a woman can get a spinal headache, which basically happens from spinal fluid leaking out of the epidural site, so that every time a woman sits up, she gets a really horrible headache, but when she lays back down, then it's relieved. And that spinal headache usually either resolves on its own or can be resolved with something called a blood patch. And then finally, this is kind of debated, but the epidural potentially may cause breastfeeding issues with the baby. Some studies have shown that this is true, other studies have shown it is not true. So it's one of those things that we're not really sure which it is, but just something to kind of think about when you're planning pain relief for your birth.